Hi, Ina. Nice to see you again.
Good to see you again.
So, I know we've run several tests on your eyes today. So, I want to talk to you a little bit about some of those tests. And we do these tests to help us determine the best treatment for you in order that we can optimize your vision. Does that sound good to you?
Sounds good.
Okay. So, the first test we're going to talk about today is something called the AccuTarget HD. And that's the scan that you see here. Now, in this particular scan, we're trying to understand your quality of vision, okay? And that's a very important measurement because it's different than what we do in the exam room when we just see, subjectively, can you read 20/20 or 20/30 of one of those? It tells the doctor, myself, what the quality of your vision is and how you see images. So what you're gonna see here in the top picture of the baby, this is how a perfect person would see, someone that has perfect vision. If someone had a clear optical pathway from their eye to the back of their eye, the retina, they would see like this. Now this is your eye. And you can see that it's a little bit blurry, and I don't want you to be concerned about that because we're gonna do other tests to determine why you're seeing this way. This scale over here, called the objective scatter index, it goes from green to red and goes from 0 to 10. And this scale tells me about how well you see or the quality of your vision. Okay. Now you scored a 3, which is in the moderate range. Okay. So I would like to get you seeing better than that. Okay. So we're going to run some other tests to look into that further and talk a little bit more about what your options are. Does that sound good?
Sounds great to me.
Did you have any questions?
Let's look to find out what's causing my vision to be blurry.
Okay, great.
Thanks.
All right, Ina, so the next test we're going to look at from the AccuTarget HD is the tear film analysis. Now, this particular test measures the quality of your tear film to help me as a doctor understand if you may have a condition known as dry eyes. Dry eyes can cause symptoms such as blurry vision, stinging eyes, watery eyes, and sometimes a foreign body sensation, okay? And what I'm looking for on this test is see if your tear film may be dysfunctional, which the way I evaluate that is I look at your tear film evaporation rate. Now, when we look at these measurements here, I see that your tears are evaporating at a very quick rate, and what that's causing is some blurry vision. So I don't want you to worry about that because that's something that we can easily treat by adding more moisture to your eyes. And one way we do that is by utilizing artificial tears, okay, which I have here, and you can put these in your eyes 4 times a day, and that's going to add more moisture to your eyes and help stabilize your vision. So not only will it help your tear film, but it will improve your quality of vision at the same time, okay?
Sounds good.
All right, so now we're going to move on. I want to show you some additional tests as well. So the next test we're going to look at today from the AccuTarget HD is the depth of focus test. Now this particular test allows a doctor to understand a patient's range of vision, and that's the ability of the patient to be able to see from far to near. So let's go ahead and look at your test results here. When you see here at the 0 point, this is a clear E, and that represents your distance vision, but as we get into your intermediate and near vision, it looks like your images, or the E here, starts to become blurry. So I want to ask you, are you having problems with your reading vision or your near vision now, Ina?
Yes, I wear reading glasses.
Okay, and that's exactly what this test tells me. And it's very common in the ages of in the 40s to 50s to start experiencing problems with your near vision and intermediate vision. And that's why sometimes our arms just aren't quite long enough to be able to keep that print clear. The nice thing is we have a lot of options now to be able to address this condition known as presbyopia. So what I'd like to do now is take a look at our different options and create a lifetime vision plan for you to see what options are going to give you the best vision long term.
That sounds good. Let's do that.
Great. All right, Ina, now that we've completed all our testing today, I'd like to summarize all the results for you. So the first thing was the OSI score, or the objective scatter index. This was a little bit higher than I normally like to see. So we're going to do some further testing when you come back to investigate a little bit further into what could be causing this.
Okay.
The second thing was the tear film analysis. The tear film analysis showed me that your tear film is a little bit dysfunctional, and so I do want you to go ahead and use these eye drops, okay, 4 times a day as I prescribed earlier. And then I'd like to see you back in 2 weeks and see how your tear film is doing. We'll run some additional tests, and then at that point we're going to look at what surgical option is going to be best for you. to give you a lifetime of clear vision.
Very good. Thank you.
Great.